So the meds treat the symptoms, but they don't treat the actual problem, which is the enlarged prostate. So a lot of people wait until it's gotten so bad and they can't stand it anymore. And really, we would love to see people at the onset of symptoms.
Welcome to Your Healthiest Life podcast, where we bring you practical, trustworthy health information to help you take better care of yourself and the ones that you love. I'm your host, Kyle Dyer, for this week, and today we're talking about something that affects millions of men and nobody is talking about it. Prostate health in men and BPH. What is it? What does it do to the body? And there is a new treatment within Intermountain Health that can help. Okay? If you are brushing off any symptoms, telling yourself it's just a part of getting older, it's just how it is, or you know someone who's doing that, you need to listen to this conversation. Today we have Dr. Katie Scott joining us, a urologist with Intermountain Health. Thank you so much for being here.
Yeah, thanks for having me. This is my favorite area of urology, so I'm excited to talk about it.
Okay, first off, what is BPH?
So BPH is an enlarged prostate,
Okay.
which is something that is very common as men age. It's something that is just kind of genetic based. So a lot of people wonder, is there something that I'm doing, not doing, an exercise, a dietary change that has caused this or could make it better? No, you don't really have much control over it. More importantly, it's not cancer. So a lot of patients come in and they wonder, is this cancer? Do these symptoms mean that I'm sick? No, it's just an enlargement of the prostate as someone gets older.
Okay, we're going to get into more about BPH in a second, but you mentioned something about, is it just getting older? I bet a lot of us, as we age, don't go to the doctor right away because we just think this is what's happening.
Yeah.
When should somebody go see someone like you, a urologist?
You're right. So a lot of people wait until it's gotten so bad and they can't stand it anymore. And really, we would love to see people at the onset of symptoms. So as soon as someone starts noticing a change in urination or something that's bothersome with them, that's where we can start intervening early and avoid things down the line that are more complex. And right now, what's happening is they're typically put on meds, and then we see them when the meds stop working or they're kind of giving up.
Okay, so are there risks then to just keeping on the meds and not seeing a specialist like yourself?
Yes, and that's one of the things that we're really, as a specialty, trying to change the thought process around. So the meds treat the symptoms, but they don't treat the actual problem, which is the enlarged prostate. And so if we leave that untreated over time, things are going to progress. And the big thing we worry about is the damage that it takes on your bladder. So if your prostate is blocking your bladder from draining, the bladder is going to have to work harder. And if you make it work and work and work over years and years and years, it's going to sustain damage. And at some point, that damage is something that we just can't help with. So we definitely want to see patients before that point.
Okay, when they start feeling the symptoms, you mentioned, so the uncomfort, what else could they be experiencing?
Symptoms?
Yeah, what are symptoms?
So some of the very common ones: weak stream, slow flow, getting up a lot at night to urinate. Some patients will say, I don't feel like I empty my bladder all the way. I'm pushing, straining, doing these maneuvers to get urine out. But also things like urgency, frequency. So if you're someone that knows every bathroom in the grocery store, that's not normal. You don't have to live like that. And that's when you come see us.
Okay. Can you have just one of those symptoms and you should go, or do you wait till you have all those?
You know, that's up to the patient, but just one of those symptoms is the first sign. So generally it's going to start with one symptom, and then over time, as things get worse, you're going to add more of those on. And that's unfortunately when we see people.
Okay, BPH, how common is this?
So very common. The percentage of men roughly matches year and age. So over age 80, about 80% of men have BPH. But the rough estimates are about 12 million men in the United States that are being treated for BPH.
That are being treated?
Mm-hmm.
Yes, because you say that quite often you just go to your primary care and you're not getting the full treatment through a specialist. How are there certain symptoms, or is it lifestyle, or is it age? Is there anything we can do to prevent this with our guys?
There's not anything that an individual can do. So again, it's genetics. So there's not much influence they have. Really what you can do is establish with a urologist. So we have office procedures where we can scope the bladder and we can evaluate how healthy it is and kind of see, are you at risk of developing bladder damage over time? Are you already there? Where are you at on that spectrum? And then if you're someone that's showing signs of that or severe symptoms, we can treat that with surgery.
So the scope is the first check to see how severe the situation is.
Yes, that's a lot of our initial workup. So if someone comes in with a lot of symptoms, they've been on medications, they're not working, they don't want to be on medications. A lot of times we'll start with a simple scope in the office and take a look at their bladder. And then I can see how healthy it is. We get a lot of information about the prostate size, shape, confirm that that's the problem. And then we can talk about all the different things we can do to fix it.
Let's talk about the fixing it. What can you do?
So there's medications, like I said, that really just treats symptoms. The actual fix is addressing that overgrowth of prostate. So that prostate is blocking the urinary channel. It's basically a clogged pipe. So that's why I tell patients it's plumbing. You've got a clogged pipe. I need to unclog it. And so there's different ways that we can do that. So there's office-based procedures. There's surgical procedures in the operating room, and those range from different levels of invasiveness, essentially. Okay.
How do you decide which way to go if there's so many different options, from drugs to various levels of surgeries?
Yeah, a lot of that depends on the patient. Okay. So, if their goal is to avoid surgery and their bladder's healthy, we can treat symptoms with medications. But we always talk about risks of that and that bladder damage that can occur. So then the procedures some of them are based on size of the prostate, different things that we see on that scope, the architecture, what would work for them. But I like to go through everything that is available, what we offer, pros and cons of each. Some of them are quicker recoveries, some of them are longer, some of them have more durable results, some are going to maybe not last as long, and just kind of help them make that decision based off of what they value.
There's some new procedure that you have in your office, right?
Yeah, so we have a new technology at Intermountain. It's called transurethral water jet ablation. And this is a surgical procedure for the prostate. So this is a newer technology that basically takes an older way of treating the prostate, which is called a TURP, where we would go in and cut the prostate tissue out. So now we are using image guidance with a robot and AI, and using, instead of heat or cutting the tissue, we're basically ablating it with a pressure washer of water. And all of these advancements allow it to be safer. We can do it faster and more precise. Part of the benefit of using the water to ablate the tissue rather than heat is we decrease a lot of the side effects and the risks of the procedure. Most of the prostate surgeries, I tell patients they're not painful after. It's more just comfort because we have catheters in place for a short time, but typically not something that's causing pain like they would think of with an incision.
Okay, let me ask you about prostate cancer too. This is not anything that goes down the way towards prostate cancer, which is so common and is diagnosed with a blood test. Mm-hmm. This is not that.
This is not that.
And this doesn't mean if you have enlarged prostate that you could get prostate cancer.
No.
So there's no reason someone should not go to their urologist.
Exactly, yes.
Because I do feel that's probably a concern that, oh my gosh, I could have cancer. Maybe.
Yeah, I think a lot of people are afraid of the unknown and sometimes just content to not know, and they don't want to come in and find out it's something bad. But if something's going on, it's going on, whether you know about it or not. But most of the time, these symptoms are not indicative of cancer. They're just an enlarged prostate.
Let me ask you about your patients. It's a hard thing to talk about. And I mentioned at the top how people aren't talking about it. Mm-hmm. Why is it? I know it's personal, but I mean, when you have people finally sitting in front of you in your office, they must feel some kind of relief that, okay, here's someone that can help me.
Yeah, I think a big part of it is it's normalized. So people just think this is part of getting older. This is normal. And it is part of getting older, but it doesn't mean that we can't help or do something about it. I think there's a little bit of a degree of people just don't understand that there are options available. They don't have to live with it. So we have a lot of patients who saw their dad struggle with urination for years and years. It was never helped. We didn't have the technology back then. And so they just assume that's how it is now. And now we have so many medications, so many procedures, so many surgeries. It's not scary like it used to be. So there's a lot we can do. I think people just don't know that.
Are there other men's health issues that they're not talking about that you wish they would?
I would say prostate cancer screening. So while this isn't prostate cancer, that's another important area. There is a lot of, I think, things that patients don't understand about that. When should it happen? What does it mean? That's probably one of the big ones. As urologists, we are specialists of the male reproductive tract. So we're essentially the gynecologists for males. And so all those questions that men have and they don't know who to ask, we are the ones that, if there's something there, they can ask us.
What intrigued you in this line of work?
I like urology because it's a lot of medical management with surgical management. So you get a lot of continuity of care with your patients. So you're not just seeing them for a pre-op visit, doing surgery, post-op visit. You never see them again. You manage them through the years. You get to know them. You get to think and diagnose things. And it's a tricky specialty, and it keeps it interesting.
Okay. All right. You're a partner in there as they age and as they continue to stay healthy, we hope. Is there a piece of advice that you would give to those listening, both men and women?
Yeah. I mean, especially focusing on the BPH, I would say ask for a referral to a urologist. Primary cares can start that process of treating you with medications, but we're the ones that have all the tricks and the tools, and you don't need to stay limited to medications that maybe aren't working, aren't effective, that have side effects. So open that door, ask to come see us, call us. You don't necessarily need a referral. And we can start talking about all the things that are available.
Okay. And it's not scary. It's going to be helpful in the long run. Okay. We try to end on a positive note, but I think you brought a lot of positive information today. Is there something that gives you hope in terms of men's health? Obviously, the technology is always improving in terms of treatments, but what else is out there that makes you really happy and hopeful?
I think there is a lot of push towards preventative medicine. And so I think as a field, we're looking at risks of just keeping someone on medication for many years, and how can we actually shift things so that we're seeing people early when we can intervene earlier at lower risk. And there's a lot of interest in developing the field. Things like aquablation, where we're trying to improve these procedures, eliminate some of the things that keep people from seeking them out. So I think there's a lot of interest in development in the field that hopefully helps us push the needle to where we're helping patients earlier and avoiding risks.
I have one last question. Is there a certain age that people should be asking, even if they're not sure what their symptoms are, that men should start going to see a urologist for some of this?
I mean, definitely around age 50 and above is where it's going to be more likely that this is BPH, but I've certainly seen men that are younger than 50. So I would say anytime you have a question, you can ask to see a urologist, and we're happy to help. Okay. All right. Anything that I haven't asked you that you want to share with our listeners? I don't think so. I think we covered it. Yeah.
Okay. Katie, thank you so much. Very encouraging to speak with you today. So appreciate it. If you have noticed any changes in your urinary health, have any questions about prostate health, or you haven't been checked out by a doctor in a long time, or would like to see a specialist in this field, go to intermountainhealth.org to learn more or schedule an appointment with a provider near you, because taking care of yourself today, getting those questions answered will make for a healthier tomorrow, and that is what we want. Join us next month for Your Healthiest Life podcast. We will have another expert here from within the hospital system to talk about something that you probably need to know more about. That's what we're here for. We're also on Spotify, Apple Podcasts, and of course you can watch on the YouTube channel. Have a great day, everybody. I'm Kyle Dyer. I will see you next time.